Greetings, New Zealand naturopath Eric Bakker, author of Candida Crusher, and I'm also the formulator of a range called Candida. Thanks for checking out my video. It's incredible how many emails I get over the years I've seen, and also feedback I'm getting on YouTube with people saying, "Help, I've got bad breath. What am I going to do? My mouth is stinky. It's affecting people, my relationships. I'm really embarrassed. My girlfriend hates me, or my boyfriend hates me. I can't talk to people anymore. I'm staying inside. What am I going to do?" So, well, if you go to sites like WebMD or all these other kind of sites, the Mayo Clinic and stuff like that, you're going to find 3 or 4 or 5 pages all relating to bad breath, the causes, the treatment, all the potential things. I mean, I looked at one site and it talked about flipping rectal cancer or something linked to bad breath. I mean, be careful what you read. I'm going to have to do some videos on be careful about Dr. Google, because lots of people spend way too much time on the internet trying to find out what's wrong with them. They go to Symptom Finder. The funniest one was I had a lady who thought she had a rare kind of brain tumor, and she found through Symptom Finder. So I'll talk about that another time. But bad breath is a condition called halitosis, and it affects many different people. Now, bad breath can range from, not so good to, whoa, go away from me, don't come near me, to really fecal breath, to the point where you're almost dry reaching. I've been seeing patients for some time, and now had, over the years, only the odd handful of patients in my room so bad that I just about dry reached. It was really, really offensive, seriously offensive. And the tragedy is many people with bad breath, seriously bad breath, are not even aware of it themselves. Some people have had breath so bad for so long that they've become used to this bad breath. A bit like body odor, a bit like dandruff, a bit like certain skin conditions. If you live with something long enough, it becomes part of who you are, becomes part of your relationship with your body. And your partner may accept it, your kids may accept it, and to the point where you think, well, it's normal. I've got dandruff like snowflakes all over my clothes. It's normal. What's your problem? Nothing wrong with dandruff. I've got a friend like that, and every time I look at him, it's almost like he's been out in the snow, And I've got another friend with breath that's very offensive, and I've spoken to him on a few occasions, and he said, look, there's nothing wrong with my breath. There really isn't. But when you pull your head back when someone talks to you, it's pretty stinky. Okay. So what causes bad breath? What can we do about it? How can we remedy bad breath? Well, we could set up a YouTube channel on bad breath alone. That's how many videos I could do on this one particular topic. So this will be one probably of a couple of videos I eventually do on bad breath. Halitosis has many different causes, as I mentioned, and they can range, from things like medications you take, food you eat, gum disease. There could be sinus problem. You could have issues with your stomach. There could be lots and lots of different causes. But the key thing that I'd like you to do if you're watching this and you've got bad breath is to ask people to be very open and honest with you, family members and friends, and give people a scale from 1 to 10, 10 being like back off, okay, don't come near this person, to 1 being okay, and get them to put on a sliding scale out of 1 to 10 what they think your breath is like. It's good for people to be honest with you and for you to understand to what degree your breath could be affecting other people. Then the second thing to do is to find out what the hell's causing this bad breath. How many people in the family have got it? Any people around you have it? There could be certain type of infectious reasons why you've got it. The main thing is get your teeth checked out. Go to the dentist and find out what's wrong with your mouth, if there is anything. Have you got gum disease? Have you been to a dental hygienist? Have you got any bleeding gums, any loose teeth? Have you got root canals, bridges, caps, or anything with your teeth there that could be suspect? That's the very first thing that you check out. Root canals is a very big one, because many people have anywhere between 1 to 5 or even more root canals, and they can become really stinky and toxic in the mouth. Okay, so it's important. Yeast infection in the mouth is not that uncommon, especially with denture wearers. I've seen quite a bit of oral yeast infections. Look at the tongue. A tongue should be a nice clear sort of colour. There can be a slight white film on the tongue for healthy people even when they wake up in the morning. But if the tongue's cracked down the centre, if it's scalloped down the sides, if it's got huge white patches down the back, that can be a big problem. The tongue is a very good indicator of digestive health. Many different civilizations throughout the millennia have actually looked at tongues and for diagnosis. The Chinese and the Indians, Ayurvedic medicine, very big on tongue diagnosis. I can remember when I was a kid, the doctor always looked at your tongue. They've got this stick out, like a big, I remember I used to think it was like one of those big ice cream sticks. They whack the tongue depressor in, and they'd say, go, ah, and then they look at your tonsils and your tongue and everything. But they don't do that so much anymore now. But that's a good indicator of oral health, but also gut health, because I believe your stomach plays a big role in what's happening in your mouth. Many times I've actually seen people improve their oral, the odor from their mouth just by digestive enzymes alone. So you could take a good probiotic enzyme formula, and that can have a huge impact on your oral hygiene. So a couple of tricks and tips for you. Make sure you chew food properly. Make sure you brush your teeth regularly, at least 2 if not 3 times per day if you've got bad breath. Floss your teeth regularly. Get your teeth checked out. Make sure that you're eating a whole foods diet and not some crappy McDonald's, a diet with every time you have a drink, you have a sip of Coca-Cola. Well, that's not going to do a lot for your breath or your gut, is it? So what you eat will dictate to a big degree what you look like, how you feel, and also your gut health. So eating good foods, and especially whole foods, you'll have a lot less chance of having stinky breath. If you're going to rely on nuggets and burgers and fries and Coke with meals 2 or 3 times a day, well, you're probably going to end up stinky and fat and have a lot of other associated health problems. Tea tree oil toothpaste is quite a nice one to use. Baking soda on a clean toothbrush can help quite a lot too. Please keep away from those alcohol mouth rinses. I think they're really crap for the mouth. They kill off the bacteria. Do you wash your whole body down in a bottle of methylated spirits when you go and have a shower? Do you do that? You get half a gallon of methylated spirits and pour it over your head, and well, that's what you're doing with your mouth with those oral rinses. I think they're crap. I can't understand why people use mouth rinses for. When you've got a healthy diet like I have, you chew food properly, you've got good dental health, your breath smells quite sweet. There's no pong, no stink, and you don't mind being around other people when they're like that. Nothing worse than having an offensive breath. Try the probiotics, try the enzymes. It's going to help you quite a lot. Another one that you may want to try is zinc lozenges, zinc and vitamin C lozenges, because they can really add to the oral health as well. So there's just a couple of tips for you to try and get your head around the bad breath. But the investigation is an important part. Go and talk to your doctor or naturopath about the bad breath. It's important for your practitioner to have a good examination of your lifestyle and diet to see where the potential is, the causes. Because I can tell you now, if you nail this cause, the stinky breath will go away. And that's going to really increase your confidence. I can't tell you how many people I've seen over the years with bad breath that cost them their relationship, their occupation, everything. All because of the odor coming from the mouth. It's not pleasant. Food for thought. Think about it. Thanks for tuning in.